All right, welcome everybody. I'm Joanna Manzi. I am the Assistant Director of Benefits with the Human Resources Department located on the Athens campus. Our department is in charge of administering the student health insurance plan. So today I just wanted to kind of run through kind of like a student health insurance kind of 101 presentation real quick, and then kind of navigate the website with you to show you where you can find information about the plan, where you can search for providers. Since all of you are located there in Tifton, just I can't really see everybody, but are most of the people in the room, are most of you mandated to have health insurance coverage where you're charged through your student account?
Yes.
Yes.
Okay, is there anybody there who's not mandated? No? Okay. All right, so I'm going to skip one little section of our presentation, so I'll be good. All right, so just, real quickly, just wanted to run through the student health insurance, kind of a basic presentation, general overview of everything, how everything works as far as administration is concerned. And we'll take questions at the end. I also wanted to kind of walk through the website with you, and I'll do that at the end. Okay, so today we're just going to talk about where you can find information about student health insurance. I'm going to talk about what that means for you as a mandatory student. We'll also, we're going to skip the voluntary section since nobody's voluntarily picking up coverage. And then we're just going to kind of go over a quick overview of the student health insurance plan and then talk about some other options that are out there for you. So the first place that you need to go to find information about the student health insurance plan is on the Human Resources website. It's hr.uga.edu. And if you click on students in that red menu bar, that's where you'll get to the student insurance page. So who's mandated? The University System of Georgia, they mandate certain groups of students across the entire system, across the entire state, to have eligible health insurance coverage. So those are international students holding an F or J visa status, students enrolled in programs that require proof of health insurance coverage, and those are our Doctor of Pharmacy program and the Doctor of Veterinary Medicine program. Then any graduate students who are receiving a tuition waiver as part of their qualified graduate assistantship, or any graduate students receiving a qualified fellowship or training grant that is fully funded, that fully funds their tuition. These fellowships and training grants have to be administered through the UGA accounts payable system. So if you're receiving a fellowship or a training grant that is being paid directly to you or being applied to your student account, those may or may not be qualified. We kind of have to look at how those are set up. So what does it mean if you're a mandated student? What that means is you fall into any of those groups of students, you're going to be automatically charged for the mandatory student health insurance plan on your UGA student account. So once you get registered for classes, if it's because of your visa status and or because you have a graduate assistantship, once you get registered for classes, that charge should get assessed to your student account automatically. So for this year, right now we're in the spring summer coverage period. When you're mandated, we are assessing you student health insurance charges by the semester. So during the fall, you were charged for the fall coverage period, which is effective from August 1st through December 31st. And then during the spring, you're charged for spring summer coverage, which is effective January the 1st through July 31st. So is there anybody in the room who does not have a graduate assistantship? Does everybody have a graduate assistantship?
Yes.
Yes. Okay. So if you've got a graduate assistantship, you're eligible for the UGA premium subsidy. So you're going to see the total charge for student health insurance be assessed to your student account. So for this spring, that amount was $1,551. But you're also going to see applied to your student account a health insurance premium waiver. That is detail code OH19. That waiver is going to waive off 50% of the student health insurance charge. So it's going to waive off $775.50. And it's going to leave a balance for a graduate assistant to pay of $775.50. So if you've got that qualified graduate assistantship, you're only paying 50% of that total premium. If there's anybody in the room who does not have a graduate assistantship, you are getting charged that full $1,551, and that would be your responsibility for paying. As far as paying your fees, all charges, including student health insurance, must be paid by the deadline set by the bursar's office, by student accounts. If you have any fees outstanding, including student health insurance, on the day that they're going to assess late fees or the day that they're going to cancel schedules, you will be either assessed that late fee or have your schedule canceled. Now, why that is important, we do leave the waiver period open longer than the deadline set by the bursar's office. But just because you plan to submit a waiver request, say a week after they assess late fees, that doesn't matter. You've got to have your account balance at zero on the day that they assess those late fees or cancel schedules, or you're going to get, that fee or schedule canceled. So just be aware of that. Yes, we do give you a longer period to submit that waiver, but if you're going to wait, what I advise you to do is go ahead and pay your student account in full so that you do not get that late fee or schedule cancellation. And then if your health insurance waiver gets approved after that, it will be refunded to you. We do have some students who will wait and then they get assessed that and they're like, well, I planned on submitting a waiver request. That doesn't matter. You have to have your account balance down to zero by those deadlines so that you don't incur the late fees or schedule cancellations. Now, if you're a graduate assistant, you can sign up for the graduate assistant payment plan. You can do that through Athena. If you sign up for that graduate assistant payment plan option, then you will not get assessed the late fees or schedule cancellations. So that is one thing that you can do as a graduate assistant. And also, just so that you're aware, that premium subsidy, that 50% premium subsidy, it only applies to the student's coverage. There is no premium subsidy for dependents if you're going to cover any dependents. So some things have to happen first before you're going to be able to access the insurance system to set up or waive your coverage. The first thing that has to happen is you need to be registered for credit hours for the semester, whatever semester we're in. That's step number one. So it shows that you're an active student for that semester. If you have a graduate assistantship, your department has got to have that graduate assistantship tuition waiver applied to your student account. Once those things are done, you also want to make sure that you have a US-based address on file. The insurance company will not take an international address if you're an international student. So you want to make sure that's set up. And then you also need to have your UGA email set up. So once you have all that done, you typically can access the insurance system to either activate your coverage or to waive your coverage approximately 48 business hours after you're assessed the charge for student health insurance on your student account. We do have to send a file up to them with your information. Until that information gets sent to them, you're blocked out of their account, okay? So that's important that all these things happen so that you can get into the insurance system. So if you're a mandated student, you need to take action. You need to either activate your coverage each semester, or you need to submit your waiver request to opt out if you have other acceptable health insurance coverage. So just being charged on your student account, that is not activating your coverage. We cannot do the automatic activation until after the waiver period closes. So we encourage you to take action and take either one of two steps, either activate coverage or submit your waiver request to opt out. So if you follow the directions in the emails that we send out, or just off of our website, it's going to direct you to go to the United Healthcare Student Center page. And on that page, you're going to, when the enrollment waiver period is open, you'll see two buttons there. One is either waive coverage. That means you have other health insurance coverage. So you want to opt out of the student plan, or you do the opt-in button if you want to enroll in the plan and activate your coverage. So as I mentioned before, when you're a mandatory student falling into any of those groups of students that I talked about, you enroll by semester. You're not enrolling or waiving for the entire academic year. So you have to take action in both fall semester and spring semester. The action that you take during spring semester, that applies to spring and summer combined. So if you enroll or waive coverage during fall, you're only enrolling or waiving coverage for the period of August 1st through December 31st. If you enroll or waive coverage during the spring semester, you are enrolling or waiving coverage for the period of January 1 through July 31st. So that's important to know. We get a lot of phone calls from students in like January saying my coverage isn't active. That's because you haven't gone in there and activated it. You have to do it each semester. There's no annual coverage under this plan. It's by semester. So what happens if you don't take any action? You don't enroll or you don't waive? Because you're mandated to have health insurance coverage, at the close of the waiver period, any students who have taken no action, or they do not, or they submitted a waiver request, but it wasn't approved because their coverage wasn't acceptable, we will automatically activate coverage for those students after the close of the waiver period. So that waiver period for spring summer of 2023, that waiver period closes on February the 15th. So that means if you haven't done anything, you're not going to, and you don't take any action yourself, your coverage isn't going to be active until after February the 15th. So that's why we encourage you that if you know you're going to enroll in the plan and you don't intend to opt out of it, go ahead and activate coverage yourself so that your coverage is active, is ready to go if you need to go get a prescription or if you need to go see the doctor. Because there's nothing worse than just standing at the pharmacy or standing in a doctor's office or the emergency room, and they're sitting there telling you you don't have active health insurance coverage. It's because you haven't gone out there and activated it. So take action yourself. Go ahead and get it activated so everything is set up and ready to go if you need to use it. Under the student health insurance plan, there is dependent coverage. You can enroll a legal spouse or any dependent children under the age of 26. We have premium information for the dependents on our website. What you do is you're going to enroll your dependents through your United Healthcare Student Resources account. But what you have to do first is activate your coverage. So you need to activate your coverage first. Then you can log into your United Healthcare account and purchase dependent coverage. You will pay the insurance premium directly for the dependent coverage, and that coverage period premium is due in full at the time of enrollment. And the deadline to purchase dependent coverage for the spring summer 2023 is February the 15th. Now, anybody that enrolls during this enrollment period, either you're activating your own coverage or you're purchasing coverage for dependents, as long as it's done by the February 15th deadline, you will have coverage retroactively back to January the 1st. So you are buying coverage from January the 1st through July 31st. Once you've set up your coverage and activated it, you need to log into or create, if you're a first-time user, your United Healthcare Student Resources account. That's very important because United Healthcare, they don't mail anything to you. They're going to communicate with you through this account. This is where you're going to find all your documents, including your insurance card. Everything is provided to you electronically. So if you're a first-time user, when you go to the My Account website, you'll click on Create Account, and you're going to set up a username and password of your choice. We don't know what those are. It's whatever you set it up to be. But once you're logged in, this is a resource where you literally can find all the documents concerning student health insurance in one spot. You can enroll your dependents through that. You can print your insurance card. You can view your explanation of benefits. You can search for providers in all over the country if you're traveling around. You can see what your coverage effective dates are. We have students who contact us all the time and have no idea when their health insurance coverage ends. You can always log into your United Healthcare account and see the coverage effective dates for your coverage. You can also find the plan brochures that detail out how the plan pays and what it covers, what it excludes, what limitations are. All of that information is in that plan brochure. You can also print out a confirmation of coverage. If you need to provide some type of proof of coverage to anybody, either for a visa, because you're traveling or something like that, that is available through this website. Also, right now, if any of you had coverage in the 2022 calendar year, you can obtain your 1095B form to file with your tax return. That form is available to you directly through your United Healthcare Student Resources account. Is under your coverage tile, and you can print that off, that tax document off for your to file with your insurance. I'm sorry, to file with your taxes. So some of you may have other acceptable health insurance coverage, and you want to opt out of the mandatory student health insurance plan for the semester. You do have to have other acceptable coverage, and there is a list on the website, linked off of our website, about what certain requirements that other coverage has to meet. It has to be Affordable Care Act compliant coverage. Or if you're an international student, if you are fully backed by the full faith of your government and they're providing you coverage, that may qualify. It has to be reviewed. Or if you're in some type of an exchange program like Fulbright, the Fulbright insurance may qualify also. So those have to be reviewed. But essentially, you've got to have Affordable Care Act compliant coverage. So if you're an international student and you're just looking to purchase coverage on your own, there are a cajillion different international student health insurance plans out there on the marketplace. They're very cheap. The premium is not very much. That seems very enticing to students, but there's a reason that it's cheap. It's because it doesn't cover much. Those plans are not acceptable to waive out of the student health insurance plan. The University System of Georgia requires everybody to have Affordable Care Act compliant coverage. Essentially, where you can purchase Affordable Care Act compliant coverage out on the marketplace is through the Affordable Care Act marketplace. The state of Georgia uses the federal marketplace. Information is available concerning plans that are available in your area. The website is healthcare.gov. That's healthcare.gov. That's where you can get to the Affordable Care Act marketplace website for the state of Georgia. So if you do have you submit a waiver request and it's approved, that approved waiver will be applied to your UGA student account within 7 business days from the date of approval. So once again, going back to those deadlines that student account sets for paying your fees, if you go in and submit a waiver request on the day that they're assessing late fees, that waiver is not going to get onto your student account in time. It takes up to 7 days to get applied to your student account. So you need to plan for that and allow enough time for the waiver to be reviewed and processed if you're trying to get the charges off before the late fee and schedule cancellation deadlines. So to submit a waiver, once again, you're going to go to that Student Center website that is available through the United Healthcare Student Resources site, and you're going to select Waive Coverage. The deadline for spring, summer of 2023, you're waiving out for that period of January 1 through July 31st of 2023. The deadline to submit your request is February the 15th. Once you submit your request, you should get a confirmation page that's saying you submitted it. Make sure you print that. That is your proof that you submitted your waiver request. I'll have students contact me who think they've submitted a waiver request, but they can never show me the proof. If you don't have the proof, then there's nothing in the system showing you did it. There's nothing we can do. We have to have that proof. So make sure you save that. And they should also send you an email. Make sure you save that. If your waiver request is denied, but you feel that you do have Affordable Care Act compliant coverage, there will be a link in the declination email that you get that you can submit an appeal through. And so you would just need to follow the steps that they provide you for submitting the appeal and provide whatever documentation they're requesting from you. Okay, I'm going to skip the voluntary section. Just going to go over some highlights of the plan overall. One of the questions I get a lot from students there in Tifton is, do I have to go up to the health center to get my care? The answer is no. A referral is not required from the health center as long as you are seeking treatment more than 30 miles from campus. This is the list on the presentation here of when a referral is not necessary. So if you're seeking treatment down there in Tifton, you're more than 30 miles from the health center, so a referral is not required. That's exception number 3 on this list. So you would just want to find care from an in-network provider there in the Tifton area. And at the end, I'll show you where you can search for providers online, or you can always do that also through your United Healthcare Student Resources account. Just to explain to you what a referral is permission for an insured individual to consult with another physician or hospital outside of the UGA Health Center. So our students here on the Athens campus, that applies to them. But they're down. So if any of you do transfer up to the Athens campus, at that point, that would apply to you. But as long as you're there in Tifton seeking treatment, you don't have to worry about getting the referral. So where can you find in-network providers? There in the Tifton area, or if you're traveling, say you're in Florida on spring break and you need to go see a doctor, how do you find in-network providers? You can search online, and we're going to go to that website at the end once I'm done with the presentation. If you go to the website, you'll see a drop-down Find Providers menu underneath the picture of the students, and that'll give you the search function to search for providers. You can also log into your United Healthcare Student Resources account to find providers, and they have links there for you within your account. And you can always also call into United Healthcare Customer Service, and they can assist you with finding an in-network provider. And I'll talk a little bit about why it's important to use an in-network provider versus an out-of-network provider. And that's going to be, you'll notice the differences as far as your benefit coverage is concerned. I'm going to just talk about in-network and out-of-network versus the health center, since everybody's down there in Tifton. So you want to try to utilize an in-network provider for your care. That's important because these providers have signed a contract with insurance companies saying they'll be reimbursed a certain amount of money for a procedure. If they actually charge more than what they have agreed upon in their contract, they just have to write that amount off. They can't charge it to you. So right there, you typically see cost savings because they're going to write off a portion of that charge because it's above what they've agreed upon in their contract. So if you're going to an in-network provider, you have a $500 per policy year deductible that you have to meet first. So what that means is the first $500 worth of your medical expenses that you incur within a policy year, they are your responsibility for paying. Once you've met that deductible in a policy year, insurance will then pay 80% of allowable charges and you pay 20%. So let's just say, for example, you go to the emergency room and the emergency room visit is $1,000. Let's say the negotiated contract rate with United Healthcare is $600. So that's $400 difference between what they actually charge of $1,000 and what's okay under the contract. The provider's just going to write that off. You're not responsible for that $400. So you now have $600 remaining. Well, you haven't met your deductible yet. So you're going to pay $500 of that $600 that are remaining. You've now met your deductible for the year. There's still $100 left. Insurance is going to pay 80% of that $100 or $80, and you're going to pay the remaining 20%. So for that $1,000 emergency room visit, you would have paid $520 of it because you had to meet your deductible. Well, let's say you go to the emergency room next week. You've already met your deductible for the policy year. So insurance is going to start paying 80% immediately of what's allowed, and you're going to pay 20%. You've met your deductible for the year. So that's how, in a very simplified fashion, that's how insurance works when you're going to an in-network provider. If you're going for preventive care, wellness care to an in-network provider, insurance is going to cover those services at 100%. As long as those services are services that are recommended for you based on your age and your risk group. You know, if you're a 20-year-old and you go and get a wellness colonoscopy, it's probably not going to be covered because they don't recommend that you have colonoscopies till you're 45. So it's what type of wellness services are recommended for your age group. As far as prescription drugs are concerned, you would want to fill your prescriptions at a United Healthcare participating pharmacy. Generics are paid at a $25 copay per 30-day supply. A tier 2, which is also considered brand name, that's a $50 copay, and tier 3 is a $75 copay. Now, you still have coverage if you decided for whatever reason that you wanted to utilize an out-of-network provider, but you're going to pay more out of your pocket. There is a separate $800 deductible for out-of-network services. And then once you've met your deductible, insurance will pay 60% of usual and customary, and you'll pay 40%. Usual and customary, kind of the easiest way to explain this is kind of what's the average that is charged for this type of service within an area. So the insurance company will go into an area, like a zip code area, and say, what do you charge for this service? And they'll kind of take the average cost of it. So let's say you decide to go to an out-of-network provider, and you've been 2 or 3 times, you've met your deductible. And let's say they charge $200. Well, usual and customary is $100. So insurance is going to pay 60% of that $100 usual and customary charge. And then you're going to pay the 40% of that $100 charge. So you'll pay $40. Well, remember, the doctor actually charges $200 for that service. So that $100 that's above usual and customary, that's going to be your responsibility for paying. That's called balanced billing. Insurance only pays the percent of what's considered usual and customary. So if that doctor charges more than usual and customary, it's then your responsibility to pay. So that's why it's always beneficial to you to use an in-network provider. It's going to save you money as far as, because typically part of the charge is going to be written off because if it's more than what they've agreed upon in the contract. And then your deductible is lower and your co-insurance is lower also. Some other services that are provided through this plan, there is a national telehealth service available to you for both medical and online mental health services. These are free for you to use. There's no consultation fee. So if you've got something that's very minor, like say you think you have pink eye, you can call into the telehealth service. They can FaceTime with you, look at your eye, go ahead and diagnose you, and call in a prescription for you. So you don't even have to go in and see a doctor. It's going to save you money. There's also counselor access. This is not for mental health crisis situations, but there are therapists that you can chat with via text or live or the phone or FaceTime. And those are free for you. So that's something that you need to take advantage of, especially the telehealth services. If you feel like, something that's pretty minor, they can probably just diagnose you there over the phone and just call you in a prescription. And there won't be any charge for that. There's also global emergency services. This is really important if you are an international student. This is the company that is going to coordinate if you ever need medical evacuation or repatriation. We hope we never have to use the repatriation services, because that is returning your mortal remains back to your home country. Unfortunately, we have had to use it before. That phone number is on your insurance card, so you would want to make whoever, in your life, your parents or whoever, aware of that. The global emergency services they do have to coordinate that care. If you go off, if a relative or somebody goes off and tries to coordinate care on their own through a company of their own, the plan's not going to pay for it. This global emergency services is there to coordinate the care for you. COVID-19, I know we're all tired of hearing about it. Things change as things change at the federal government level as far as what's covered, what's not covered. You can always get the most up-to-date information about what's being covered. If you go onto the United Healthcare Student Resources website, they have a link up at the top of their page that says COVID-19 information. You can always go there to find what's most up to date. Okay, so just to reiterate, where do you go for care, especially since you're not here where the health center is? You've got your Healthiest You National Telehealth Service. You want to use local doctor's offices there in the community that are in-network providers. If it's, say, a weekend, or if it's in the evening after 5 o'clock and doctor's offices are closed, you can always find an urgent care facility there in the area. You will have to meet the deductible, but you do not have to worry about the referral, because you would be seeking treatment more than 30 miles from the health center. As long as you're seeking treatment, there in the Tifton area or anywhere else that's more than 30 miles away. One thing I always like to talk about, especially for international students, care here in the U.S. may be very different than what you're used to in your home country. Here in the U.S., emergency rooms at the hospital, those are intended for emergencies only. It's not intended for non-emergency care. It is very expensive to go to the hospital. It's expensive to go to the emergency room. So the way the plan defines an emergency is, in the absence of immediate medical attention, a reasonable person could believe that this condition would result in any of the following: death, placement of your health in jeopardy, a serious impairment of bodily functions, a serious dysfunction of any body organ or part, or in the case of a pregnant woman, serious jeopardy to the health of the fetus. So I always just like to say, here's some examples of why you maybe would want to go to the emergency room. You're having a severe shortness of breath, loss of consciousness, chest pain, difficulty breathing, large cuts or wounds that will not stop bleeding. You've got major broken bones or major burns, severe head injuries, or spinal injuries. Call 911 if necessary, if you need an ambulance to take you there. But if you do use the emergency room for non-emergency situations, insurance is not going to cover it. So just please be aware of that. I always tell students, I'd rather you be more careful than not. If you do feel that you are in an emergency situation. Just to give you an example, we had a student here in the Athens area who went to the emergency room, was having severe chest pain and difficulty breathing, thought he was having a heart attack. That's what he told them when he checked in to the emergency room. It ended up being a severe gastro situation that was not necessarily an emergency, but he didn't realize that. We were actually able, through an appeal, to get that covered under this definition of a reasonable person believed the condition would result in death or putting his health in jeopardy. So, because he reported when he went into the emergency room, I'm having chest pains, I can't breathe. He reasonably thought he was having a heart attack. So even though that ended up not being what the diagnosis was, I worked with him. We contacted the health insurance company to basically submit an appeal, and it ended up being approved because he was a reasonable person thinking he was in a crisis situation. So, I always say it's better to be safe than sorry. But just realize I had one student who went to the emergency room because they got hit in the leg with a soccer ball and they had a really bad bruise. That was not an emergency and they did not cover that. So I just kind of like to talk through that with everybody. Our emergency room, is in other countries, emergency rooms are lots of times used for more routine care. Here in the US, they view the emergency room to be used for emergency situations. So just a couple other insurance things that are out there for students. I just want to bring to your attention. There is an optional vision and dental insurance plan that is available, but these plans are only available to enroll in during the fall semester because they only offer annual coverage. And that coverage runs from August the 1st through July 31st. So they only offer enrollment in those plans during fall, so they will not be available again until the fall semester. But those are out there if you're interested. I do advise you to read through the policies on that plan. They are what I would consider very basic coverage plans. For example, with the dental insurance plan, you only get $500 worth of coverage. It essentially covers your routine preventative annual exams, a set of x-rays once a year, and it will provide you with some coverage if you have cavities and need a filling. It's not going to provide you with any type of major coverage for, say, a root canal or crowns. So it is very basic coverage. I really advise you to read through those brochures to make sure it would meet your needs. If you are enrolled in the vision and dental insurance plan, you can search for providers on that main United Healthcare Student Resources page for the University of Georgia. You would click on the additional info button, and then the next screen that'll pop up, it'll have that dental and vision provider search functions for you. One other plan, I can kind of see y'all. Are there any graduate research assistants in the room? If you'll raise your hand. A few? Okay. Graduate research assistants get offered another health insurance option. This plan is actually offered through the One USG Connect benefits site. You get all your communication from them about this plan. If you're a graduate or research assistant, you need to choose which plan you want. You can enroll in both. So you would want to, if you want to choose the GRA plan, you have to opt out of the student health insurance plan. You still have to submit a waiver request to do that. I really advise you to look at this plan. There is a side-by-side comparison chart on the website of these two plans. This plan is not available to J1 visa holders because it has a $6,000 deductible. So that means the first $6,000 worth of your expenses would be your responsibility for paying. That is a drastic difference in benefit coverage between these two plans. So I just want to bring that to your attention. As far as when this plan is offered to you, it works it's not by semester. You get offered this plan during your initial 30-day new hire period as a graduate research assistant. And then any subsequent annual open enrollment period, which occurs every January. So we just had an open enrollment period close for this plan. Those are the only times you can enroll in it. You're only eligible for this plan for as long as you're in a graduate research assistant job title. If you move from a graduate research assistant job title to a graduate teaching assistantship job title, you will lose this coverage. We have very few students that take this plan because of the high deductible. It's extremely high deductible. Also, if you are an international student, there is no repatriation or medical evacuation coverage under this plan. So you would have to purchase a separate policy in order to meet all of the qualifications to opt out of the mandatory student health insurance plan. So I just wanted to bring that to your attention. Lots of times we have students enroll in both plans, and we have to get all that worked out. You need to choose one or the other. Don't choose both. But like I said, we have very few students that enroll in this plan. There is not a huge difference in cost from a premium standpoint. This plan you pay by the month through payroll deductions is $103 per month. If you're on the mandatory student health insurance plan and you are enrolled for spring summer coverage, it's $775.50 for the 7 months worth of coverage. That equals out to about $110 a month. So there's only about a $7 difference in premiums that you would pay, but there is a drastic difference in the benefit coverages. So I highly encourage you to look at that if you're enrolled in this plan or consider enrolling in this plan, because it is a high deductible plan. So just to remind you, I don't want you to miss the deadlines for the mandatory plan as far as submitting a waiver request or being able to activate coverage yourself. You have that ability through February the 15th. After February the 15th, we will start the automatic enrollment process for anybody who's taken no action or who does not have an approved waiver. There can be a several day delay as we're completing that automatic enrollment process. So that's why I encourage you just to activate your coverage yourself so you can get it active and not have to wait on us to do it. Just to highlight who you can contact, you can always contact United Healthcare Student Resources Customer Service. If you're enrolled in the mandatory student health insurance plan, they are there to provide you information on your benefit coverages, any claims questions that you have as far as how a claim was handled. They can help you find participating providers. They also have an online help center. We're going to look at that in a second. You can also send questions in via email to customerservice@uhcsr.com. You can call us here in Human Resources or email us at the student health insurance email address, which is gshiplin@uga.edu. We can help you with questions concerning eligibility for the plan. Are you a mandatory student or a voluntary student? Questions about premiums and how you pay for that, and whether it's going to be through your student account or if you're paying directly to the insurance company. Just general information about the plan, and we can help answer some general questions about any enrollment or waiver issues. Okay, so I'm going to stop sharing this. Then let me go. I want to pull up the website real quick. Okay, can y'all all see that?
Yes, ma'am.
Yes.
Okay. All right, this is the Human Resources website. As I said before, this is where you can go to find general information about the plan. And you're going to go here under the students on the red menu bar, and you'll click there. It's going to take you to the student insurance and employment page. And if you scroll down, this is where you can find information about student health insurance. Whatever the deadlines are for the semester will be listed here. But if you're a mandatory student, meaning you're automatically charged, you fall into those groups of students. If you're an international student with a J or F visa, or if you've got a graduate assistantship, you're mandatory. So you can click there and it'll take you to the mandatory plan page, and where you have all this information about premiums, submitting a waiver, enrollment and insurance cards, dependent coverage. All that information is here. Life changes. Let's say you opted out of the student health insurance plan because you're still covered under parents plan. But now you've aged out, you've reached 26 and you need health insurance coverage. You actually can come onto the student health insurance plan outside of enrollment period by doing a qualifying life event. There's paperwork you would have to fill out here, and you would have to provide documentation showing loss of coverage. But just be aware that if you've lost coverage somewhere else and you're a mandatory student and you opted out of the plan, but you've now lost that coverage, you're still required to have health insurance coverage. So you either need to pick up some other acceptable coverage or you need to get onto the student plan. You would need to contact us about that. So this is kind of our page where you go to find information. And then on our webpage, you can also link out to this United Healthcare page for the University of Georgia. This is where I kind of showed you some screenshots. You can find providers here on this website. If you want to find a medical provider, you'll go to this drop-down menu, select medical. You'll change your location. Say I'm in Tifton, Georgia. And I need to find a doctor, a primary care physician within 20 miles of this zip code, and it's going to give you everybody that's considered in network. Also, let's just say you wanted to find, let's say you wanted to find an urgent care facility. Let's see. Hold on one second. I gotta figure out where that is. Let's just see. Like if you put in urgent care, it's gonna come up with different stuff for you there in the area. If you go back to the United Healthcare page, I gotta pull this down a little bit. There's also a link for behavioral health. So if you need to find a mental health provider there in the area, that's where you would search for in-network mental health providers. And you, once again, once it loads, you'll search by your location, and then you can find those. Also on this United Healthcare page, under helpful links, there's an RX drug list. This gets updated every January and July. This list provides you with what tier level a drug would fall into. It's also going to show you if there's like a prior authorization needed. I'm not sure if y'all can see it or not. Prior authorization needed, or if it's not covered, it's going to tell you that. But it'll tell you, let me get to it, what tier level you're in. So like tier 1, that's generic. Tier 3, that's going to be the $75 copay. So this drug list is out there for you to look at to help you determine how much a prescription is going to cost. Then also, if you scroll down to the bottom of this, well, this page here where it turns light gray, this is where you can find all your plan brochures on the website. So if you're a mandated student, that means you're a hard waiver student. So you click on Explore Policy. You've got your domestic certificate and your summary brochure. Your domestic certificate is going to be your very detailed information about the plan and how it covers. And there's a brochure for vision and dental also linked there. Global travel services, that's if you're just wanting to purchase a standalone plan, which you already have that in your embedded in your student health insurance coverage. But also some other information about here. If you don't know like what some terminology is when you're looking at those brochures, they have a help center here located down at the bottom of this webpage. And if you click there, there's frequently asked questions. There's a glossary of medical terms if it's new to you and you don't know what a deductible is, or you don't know what co-insurance or copay means. They also have some great videos out here. And I'm running out of time, so I want to make sure there's time for questions, but just to show you, what is an EOB? An EOB is an explanation of benefits. That's a document that you get from the insurance company that shows what they paid towards a claim. It's going to give you a column of, this is your responsibility for paying towards this medical service. That should match up, that amount that's designated on that explanation of benefits, that should match the bill that you're getting from your doctor. So you want to make sure that doctor is charging you the correct amount. That's why you always want to compare the bills to your explanation of benefits. So there is tons of videos out here about different things, like how to print your IRS 1095 form, how to waive coverage, how to find a provider, how to submit a claim if you need to submit a claim yourself for reimbursement, how to get your ID card. So great videos that kind of walk you step by step through their system to help you out if you have any questions. So I'm going to stop sharing and just open up the floor to any questions.
Anybody have a question?
I know that was a lot of information.
I have one question.
Okay.
So, in case of out-of-state medical emergencies, does the insurance cover?
Yes.
Okay.
Yeah, if you're on the mandatory student health insurance plan, that plan actually provides you worldwide coverage. Okay, so let's say you're traveling here in the US. As long as you're in the US, if they're an in-network provider, they can file that claim for you directly to the insurance company. So if you're in Florida, you're going to want to go to traveling and you need to see the doctor, go to that provider search function that I just showed you. That's either on the website directly, or you can log into your United Healthcare account and get to that same search portal. Put in where you are. Say you're in Orlando, Florida, and you need to see a primary care physician or an urgent care. And you'll just look up as far as what type of care you need, and it'll give you a list of everybody that's in network. You can search for an urgent care clinic. You can search for hospitals, emergency rooms. You know, you can find all that through there. So as long as you're in the US, you should be able to find in-network providers. They have a very large in-network across the whole country. So I've never had anybody have any issues finding anybody. Now, this plan does provide you worldwide coverage. However, if you're outside of the United States, claims do not get filed internationally, okay? That's something you need to be aware of. If you're outside of the US, typically the claims are going to be considered out of network because doctors outside of the country don't participate in the networks. The only time it would be considered in network is if it's for emergency care. That is true anywhere. If you go to the emergency room for emergency care, and it's a true emergency, that will always be filed as in network. Because if you're in an emergency situation, you know, you can't take the time to, while you're in an ambulance, to say, hold on, let me go find an in-network hospital. So that's why for emergency care, it's typically always considered in-network. But if you're outside the country, you would have to pay that doctor or that facility for your care in full, and then you got to file the claim yourself to be reimbursed. So just be aware of that. That's pretty typical in the insurance world. Any other questions?
Yeah. Do we get a free full body checkup?
When you say a free full body checkup, I'm assuming you're talking about wellness care, preventative care. That is covered at 100% as long as you're going to an in-network provider. Now, they're only going to pay 100% for services that are recommended for your age group. So that was the example that I gave. If you're 23 and you just, for whatever reason, decide you want to have a colonoscopy, they're not going to pay for that because it's not recommended that you get that service until you turn 45. Okay. So it's just things that are recommended for your age group. And you can always, and they follow the CDC, the Centers for Disease Control, guidelines for that. So what may be covered for wellness for me may be different than what's covered for you because you're younger than me. So it is based on your age and your risk group. Any other questions?
I have a question about the 1/495 form.
Okay.
Do we have to request it or you just send out to students?
It's uploaded directly into your United Healthcare Student Resources account. So it's already there available for you to print.
Do you know how does it affect our tax return or is it?
They still provide that form. What that form does is it's really for when under the Affordable Care Act, they would tax you a penalty if you didn't have acceptable health insurance coverage. That tax has gone away, but they still provide that form. Essentially what that form shows is what months you had coverage under this plan within a calendar year. Some people still include it with their tax return. So it is there. They've actually done away with the taxation, but lots of people still go ahead and just file it. So it's just available there for you to print. The one that's out there right now is for the 2022 calendar year, and it would show whatever months you had coverage under the student health insurance plan with United Healthcare. Any other questions?
Yes. So for example, if any students having any like problem, for example, in their heart or something like so cardiovascular issues, and if student wants to decide to go for example, lipid blood panel test, and he pay all the money out of his pocket, does that money like covered by, if you want to claim it, can he claim it or not?
So you're saying that the doctor did not file a claim?
Let's say he never been to doctor. He thinks that he should go for a blood panel, so then
Okay.
he go to doctors.
Okay. Typically when, for a situation like that, you're typically going to have to go and see like a cardiologist. The way in the medical world that kind of works is you're going to need to probably go see like a primary care physician first, to go over your problem, and talk to them, and then they will decide whether or not to refer you to a specialist, because a cardiologist would be considered a specialist. Typically specialists are not going to let you make an appointment directly with them without being referred there from like a primary care doctor. Your primary care doctor is typically that doctor that's going to be doing your preventative care examinations every year. That's the doctor you're going to go to, say, if you've got the flu. That's kind of who you're going to for your routine care. You typically have to have a referral from them to go see a specialist. So that's where you would start. Typically, as long as the insurance company can see that there's a medical need for you to get this, extensive lab work done, like on blood work or something like that, they're going to be looking for medical need. Well, that's where your doctor's having to provide them that information. So, if you feel like that's the case for you or somebody else, I'm going to tell you to start at your primary care physician first and then work for there, because they're going to have to submit documentation to the insurance company to say, hey, this is what we saw. This is why we're now sending them to the cardiologist. That's the type of information they're going to be looking for. Any other questions?
I have a question.
Okay.
What if part of my medication is not covered by the insurance?
Every insurance plan, unfortunately, doesn't cover everything that's out there on the market. That's the same for us as employees. If it's not covered, one thing you may want to talk to with, say, the pharmacist is to see if they have any type of discount programs for that prescription. sometimes whoever the manufacturer is of that medication, sometimes they may have some type of discount programs that you can get in to where it would lower the cost for you. The other option is, if this is significant cost for you, you may want to look for another health insurance plan. If this plan, is not covering your medications. Like I said before, if you are going to go get other health insurance coverage, it does have to be coverage through the Affordable Care Act marketplace. You would need to go online and see what plans are available there in the Tifton area. That website is healthcare.gov. Now they only offer enrollment during certain periods of the year, so you'd have to look at that. There are some what I want to call just marketplace type prescription discount programs. And I'm drawing a blank. Kaylin actually works in our office too. It's advertised on TV and I cannot think of the name of it all of a sudden.
GoodRx.
GoodRx, yes, thank you. You may want to look at that and see if you can get some type of discount through like GoodRx if it's not being covered by the plan.
Thank you.
You're welcome. Any other questions? I was going to let you know I'm actually going to be down on the Tifton campus in, I believe it's April. Let me just double check. I'm traveling a lot. Yes. Going to be down there on the Tifton campus in April, and I know we have another session set up. It'll be kind of be the same stuff, but I will be there in person and doing presentations. So, if you think of any other questions between now and then, I will be there then, or, please don't hesitate to call us or just send us an email. I hope this was helpful. I know there in Tifton, sometimes some of you are getting confused about whether you had to use the health center or not, but as long as you're seeking treatment and you're staying more than 30 miles away from the health center, you don't have to worry about that referral. Just try to utilize an in-network provider just to save money out of your pocket. So if that's it, if nobody else has any other questions, thank you for having me. And like I said, please don't hesitate to reach out to us if anything comes up that you have any questions about.
Joanna, I'd like to thank you for
You're
taking
welcome.
the time to do this. It's going to be very helpful, and you're aware we're recording this, so we're going to post it on a website we're developing for our graduate students
Okay.
here on the Tifton campus so that they can access it at any time.
Okay, sounds great. And, hope to see y'all again in April when I'm down there. If any of your friends didn't come, encourage them to come if they've got any questions. Like I said, we'll be down there. I'll be meeting with employees, but I've also got some sessions set up for the students too. Okay, well, great. Everybody have a great rest of your day, and, reach out to us if you have any questions. Thank you.
Thank
you.
you.
Bye.